Hello, and you're most welcome to the RCSI MyHealth Lecture Series. My name is Professor Steve Kerrigan, and today we are going to discuss long COVID, breakthrough infections, and booster vaccines, what the science tells us. The MyHealth series explores a wide range of areas in health and well-being and brings together some of the leading healthcare experts in these fields with the goal of empowering people with the knowledge to make informed decisions about their own health and well-being. As COVID swept across the country early last year, the primary concern was for the dying. So far, the pandemic has cost at least 5,000 Irish lives. But there are others, as many as 500,000 and counting, who are taking months and months to recover or are still struggling. These people suffer from what's called post-acute consequence of SARS-CoV-2 infection, better known simply as long COVID. Today, I am joined by Dr. Owen DeBarra, Senior Lecturer at the Department of International Health and Tropical Medicine, RCSI, and Consultant Infectious Diseases and General Internal Medicine, Beaumont Hospital. I'm also joined by Professor Fidelma Fitzpatrick, Head of the Department of Clinical Microbiology, RCSI, and Consultant Microbiologist, Beaumont Hospital, and also by Dr. Cillian McGrogan, General Practitioner at Mercer Medical Centre, to discuss this topic in more detail. Cillian, I might come to you first. Maybe you might describe for us, what is long COVID?
So long COVID, which is also called post-COVID syndrome, is a collection of signs and symptoms in somebody who has had COVID, but which persist for more than 12 weeks. It's probably a collection of syndromes rather than one single syndrome. So for example, post-intensive care syndrome, if you've been ventilated for 2 weeks, in intensive care, it's highly likely you're going to be quite unwell for some weeks subsequently, or indeed the post-viral fatigue syndrome, or indeed perhaps even a combination of those. So there are a number of presentations. There's no one long COVID syndrome. It's perhaps a combination of a couple of syndromes, such as post-intensive care syndrome or post-viral fatigue syndrome. It can present in very many different ways in very many different patients.
What are the more common symptoms of long COVID?
So the commonest presenting symptom is fatigue, but closely following that we see things like breathlessness, brain fog, mood change, either depression or anxiety, and various aches and pains, amongst, frankly, a constellation of other potential symptoms. It can frequently present as a relapsing syndrome, so people have their problems, then get better, but unfortunately a few days later the symptoms come back again, and that's obviously a most disheartening experience for the patient. In fact, we have a very useful link which we'll put up in association with this presentation from the British Medical Journal, where a number of medics who've actually suffered from long COVID discuss their symptoms, and that's well worth having a look at.
And who gets long COVID?
Well, it's important to say that most patients who get COVID, their symptoms completely resolve within 4 weeks. But for those who get long COVID, in other words, it's going on for 3 months, there is a pattern there. It does appear to be increasing with age, and it does appear to be more common in women. There's an interesting study out of King's College London, published a couple of weeks ago, which showed that 1% to 2% of people who are in their 20s will progress to get long COVID, but that figure rises to 5% for those who are in their 60s.
And is there a specific test for long COVID?
We're still unclear as to what causes it, which has made it quite difficult to develop a test to identify long COVID as opposed to COVID as an infection per se. We believe perhaps that the initial illness may overstimulate our natural immune system and cause an overreaction, or it's possible that the virus is damaging blood vessels or directly damaging cells. And I've no doubt that tests will be developed to check on those things, but they are not available yet.
Okay, and what advice have you given to your patients who present to you with long COVID?
So we try to keep an open mind. Is this long COVID or not? So the story is very important. When was their diagnosis? How firm was the diagnosis? How long ago was the diagnosis? And what exactly are the symptoms that they're presenting with now? And we're very keen that anyone who believes they have long COVID, or indeed any unexplained symptoms, should attend their GP. And this is particularly the case if you feel you haven't recovered from your previous bout of COVID, or you have relapsing symptoms, or indeed you have unexpected symptoms which you've never had before. And we would regard this as being something that is most efficiently dealt with by going to your GP. So your GP will take a good history, they will perform an examination, and they will organise some simple tests, maybe a blood panel or a chest x-ray if it's clinically indicated. And with that information, they can decide how likely is it that it's long COVID and what to do next. I think it's really important to say, as I mentioned earlier on, that the commonest symptom is fatigue. And fatigue is frankly bread and butter for GPs because there are so many causes of fatigue. It could be anemia, it could be an underactive thyroid, it could be early diabetes, it could be depression. You know, there are so many causes, and it's important that those are thought about and excluded before somebody is labelled as having long COVID. And indeed, those tests may show up COVID-related illnesses that should now be treated. So for example, many people may have some lung damage because of their COVID illness initially, and now they have a secondary infection with a treatable bacterial illness which just needs a course of antibiotics. So your GP should be able to pick that up and treat it, and hopefully that will be the end of that. But obviously we will end up with a number of patients for whom we have not picked up any alternative reason for this fatigue or breathlessness, and they then become identified as post-COVID or long COVID patients.
That's some really good advice there. And can anything be done to help people with long COVID? Like, is there a specific treatment we can give people?
Yeah, I think we start, of course, by diagnosing it and empathising with the patient and telling them that the vast majority of them are going to get better. So that kind of reassurance and positivity is very important. We concentrate on treating the symptoms. So there's lots of good advice for treating fatigue or breathlessness, and a lot of it revolves, as you might expect, around healthy lifestyle. So re-establishing a good sleep pattern, healthy eating, a graduated exercise program, what they call thinking activities, and indeed counselling if that's necessary. There are excellent resources available which cover a lot of those issues, and they're widely available on the internet. So we've gathered them together on our website at mercersmedicalcentre.com, which is a useful catch-all for many COVID resources, but we'll also put them up as part of this presentation.
Great, thanks. And do you think people will ever recover from long COVID?
Yeah, the vast majority of people will make a full recovery, and it may be more sluggish than they may like, but the absolutely vast majority will get back to their pre-existing normal function. There will be a few patients whose symptoms are causing worry or are deepening, and of course we would then avail of the services of our specialist colleagues in the hospital service who will take on their care and can run further investigations and tests as appropriate.
Great, and can I just finally ask, how prevalent is long COVID in Ireland?
In Ireland it's hard to know. There was an interesting study from King's College London recently which showed that 1 to 2% of patients who had COVID in their 20s went on to get long COVID. That figure unfortunately rises to about 5% for people in their 60s, and there's no reason to think that we in Ireland would have a different population profile than that perhaps presenting in the UK.
Okay, thank you for all of that, Cillian. And just to remind people that the links will appear at the end of this discussion. Fidel, I might come to you now. Despite being vaccinated, a small number of people are still getting infection. You might describe to us, what is breakthrough COVID infection and why does it happen?
So breakthrough COVID happens in somebody that's fully vaccinated and is diagnosed with COVID, and it's a laboratory diagnosis, so usually a PCR test. So why does it happen? Well, it happens because vaccines aren't antiviral software. They're not a firewall. They're designed to protect you against severe infection and symptoms. They're not designed to stop the virus getting to you in the first place. So what I mean by that is if you're fully vaccinated and you encounter the virus, the vaccine will have stimulated antibodies in your nasal passageways and your nasopharynx that essentially stop the virus and control the virus and protect you against getting severe infection. But it doesn't stop you getting the virus in the first place.
Okay, and how common is breakthrough infection?
So at the moment, there's a lot of data coming out from all around the world, and the bottom line is it's very rare. The vast majority of COVID cases worldwide, including in Ireland, happen in unvaccinated people or those that are partially vaccinated. So they haven't finished their vaccination course, or they are exposed to the virus very soon after, for example, their second or final dose of the vaccine. There's interesting data from the UK that's very hopeful in that 99% of the deaths since Christmas happened in people that weren't vaccinated, or rather only 1% of the deaths happened in vaccinated people. So there's one particular study that's quite interesting from the UK that kind of delved into this a little bit, and it was in a community population, because there's lots of studies in hospitals, but we don't live in hospitals, we live in the community. And they looked at people that used this COVID symptom app. So it's a very selected population. And of them, 0.2% or 1 in 500 had a laboratory test that was positive for COVID, but most of them were totally fine. They were asymptomatic and didn't know they had it. So the general themes that came out of that paper were, even with breakthrough infection that's rare, there's a good chance you won't know you have it, you're asymptomatic. If you do get symptoms, they're going to be much milder. You're very unlikely to end up in hospital. And also, you're much less likely to have prolonged symptoms, or rather that whole issue of we were just talking about a while ago of long COVID.
And maybe you could describe for us, what are the symptoms of breakthrough infection? Is it the same as the COVID symptoms?
So most people don't know they have it. They're totally asymptomatic. Some people think they've got a bad head cold, which some head colds can be bad. There's some studies that would say that you're like 50% less likely to have a fever if you're fully vaccinated. But of course, like all infections, there's a big spectrum. There's still the tail end and a small amount of people that do get your classic COVID symptoms, and they tend to be the more vulnerable patients.
And what's the concern around breakthrough infections?
Oh, there's two main concerns. And the first is the risk to people that aren't protected. And the second is, what's it doing to the virus? Are we creating the perfect storm for mutants to emerge? So what I mean by the risk for the unprotected is, if you've breakthrough infection and you're asymptomatic, you don't know you have it. Now, at the moment in Ireland, our rates of community infection are still high. They're over 400 per 100,000 population, i.e. it's high. So if there's a lot of virus circulating and you don't know you have it, we still have a section of our society that aren't protected. They're people that aren't vaccinated, people that haven't finished their vaccine course, and also the more vulnerable, as in the very old, and also those with medical conditions that are immunosuppressed. So breakthrough infection is a concern for members of our society that are vulnerable to getting an infection. The second concern is that if you have a breakthrough infection in a mixed population, so you have some people that are vaccinated, some people that are unvaccinated, and there's lots of spread going on. The question is, what's that doing to the virus? Because viruses are, like all bugs, are natural survivors, and mutating is what they do. And most people would have heard of all the different variants with COVID. And there's a worldwide effort looking and studying these very carefully, because what we don't want to happen is a big change in the virus, which, by the way, hasn't happened yet. And experts would say probably less likely to happen than flu. So it's the two concerns, the risk to people in the population, and also what's it doing? Is it creating the perfect storm?
Yeah, so these are really important points. What has the research told us about this? Are some people at greater risk of breakthrough infections than others?
Yes, and it's probably what you might expect. So certainly age is an issue, especially older age. And all the studies around the world would say that people that are over 80 specifically, but from 65 onwards, are at increased risk, but definitely 80 and above. People that live in long-term care facilities also are at risk, but generally that's because they tend to be older and probably frailer, which is also a risk factor. And then lastly, people whose immune system isn't functioning very well. So generally people that are immunosuppressed, either they have a disease like cancer or a transplant that's made them immunosuppressed, or they're on drugs that are dampening down their immune system. So it's mainly those three groups of people.
Okay, great. Thank you very much for that, Fidelma. It's very important that we understand breakthrough infection. Owen, I might come to you next. The vast majority of Irish population are now vaccinated, and already we're starting to hear rumblings about the need for a booster vaccine. Is a booster vaccine necessary, or should everyone get a booster vaccine?
Great question, and a contentious issue around the world right now. I suppose the first thing to say is we've done very well in this country with our public health experts and the population following that advice. So the plan should succeed because it's a plan that we adhere to, not because we don't adhere to the plan. So I think everyone's got to follow that advice and continue to follow that advice. So if the National Immunisation Advisory Committee come out and say you should get a booster vaccine, then you should get a booster vaccine. Exactly where that cutoff is it's going to be a little bit difficult to work out. And there's colleagues right now in NIAC working on the evidence, the best evidence available, to come up with those populations, those subgroups, a bit like Fidelma was talking about, who are at most risk of a breakthrough infection, who will get the most benefit out of those booster vaccines. We've already seen that they've talked about certain age groups and certain people who have health conditions which mean their immune system doesn't work very well. I think the bigger issue is the global inequity, and how do we ensure that we try to put an end to this pandemic? And it's a pandemic. That means that the entire world's population are at risk from this infection. And the only way to end it, to secure society, is that we offer vaccination to everybody in the world. So there's a big mismatch. We're sitting in a very good position in this country, but most of the world's population haven't got near a vaccine yet. I think one point to raise on that is that UNICEF Ireland has been at the forefront of offering people the ability to get a vaccine and donate a vaccine, so people can look at unicef.ie and can act on that if they see fit. But really, I think in Ireland, there will be those specific groups, again, like Fidelma mentioned, where we know that their immune system isn't able to make the adequate antibodies to the vaccine or have those memory cells that reproduce the antibodies to fight an infection should it come near them. And those people are at risk of breakthrough and will likely benefit from an additional dose of vaccination.
Yeah, it's a very important point that it's not just about us in Ireland, it's about global. We need to get everybody in the world vaccinated. Do you anticipate that a vaccine is going to be needed or required annually for healthcare workers or for the vulnerable population, as is in the case with the flu vaccine?
Well, I think they're quite different viruses, and a lot of understanding about vaccine schedules or how often we do them is how the natural infection is. And of course, we don't have an awful lot of information on this because it's a new virus. We know with other coronaviruses that by and large the immunity lasts for maybe 2 or 3 years in individuals. And other coronaviruses exist, and they're the common cold. So only time will tell for sure, but COVID or SARS-CoV-2 doesn't change at a rate like flu does. Flu, each year it's a slightly different strain or variant, terms we're familiar with now, but COVID doesn't change quite that quickly. So, and most healthcare workers have an adequate immune system that I think it's unlikely they'll need serial boosters. And I think as we progress through this with high vaccination rates, the impact of COVID is going to be dramatically reduced on our health and on society.
So we need to talk about the younger population now that the older population is starting to get vaccinated. And the current EU guidelines suggest the vaccine is safe for 12-year-olds and above. Should we be vaccinating younger children, such as those under the age of 12?
Not a position we've come to just yet in Ireland. I mean, first to say that the uptake again in Ireland in that group, the 12 to 15-year-olds, has been phenomenal. And most young people wanted to get it, wanted to go forward with it, and most parents were happy with that decision. So the vaccine in that age group is safe, and the benefits outweigh the risks, albeit the risks of disease are lesser in that group. Both of the mRNA vaccines, Moderna and Pfizer, are going through trials in younger age groups at the moment. That's 2 to 12 years old. And those data will be available soon. I believe they're due to be submitted to the Food and Drug Administration in the US for authorization soon. So I think it'll be fairly easy to say that they're safe in those populations. Whether they're the right thing to do in each country or each setting in the world is a different debate. And that's going to be balanced about how the disease is circulating and how it's impacting people in each society, in each country. You know, Mike Ryan in the WHO said early on in this that the pandemic will be different in each country because it's about society and the interactions. It's not just the virus. And likewise, whether a country chooses or recommends a vaccine is going to be dependent on far more than just the particular virus or the strain that's circulating there.
Yeah, some good advice there. Can we loop back for a bit here? Is there any evidence that the vaccine protects against long COVID in those who are fully vaccinated and subsequently get COVID?
Well, first off, prevention is better. So if you get the vaccine, you're less likely to get COVID in any of its manifestations, so you're less likely to get long COVID. I haven't seen anything convincing to say that the vaccine means that people have a lesser risk of long COVID. There are some signals. There are also some signals that those who have long COVID who get the vaccine improve somewhat. But I haven't seen really convincing data to that. So it's early on to say some of these things.
Great. Thanks very much for that, Owen. So we had a large number of questions that came in from the public when they registered for the talk. And we've integrated some of those questions into the panel discussion today, but we have a few other questions. Fidelma, you might be able to tell us, how long more are we going to be living with this virus?
So it's still very early days. In the last year and a half, we've had a worldwide pandemic, and we've a vaccine, and we've lots of vaccines. And as of today, over 90% of the adult Irish population are vaccinated, which is incredible. So I think that we're going to be living with this for a while, but the way we're going to live with it will be different, because we are where we are at the moment, which is totally different to what we were at a year ago. So we've already talked about breakthrough infection and the fact you're asymptomatic and you're protected. So I think as the pandemic evolves, we will learn to live with this virus. But of course, as Owen said, we don't live in a bubble. We might be in an island in Ireland, but we live as part of a global community. And certainly we all in the old days travelled a lot. And like any team, you're as strong as your weakest link. So I think the focus has to be on us getting our heads round in a fully vaccinated population, how we continue to keep each other safe, continue the infection control measures while everybody isn't safe, and then also tackle that big chestnut of vaccine inequality in the world, because what happens in other countries impacts us.
Okay, so there's a glimmer of hope there for us. Owen, I might ask you, have we reached herd immunity yet here in Ireland, or when are we going to reach herd immunity?
Yeah, thanks, Steve. It's a complicated question. And what is herd immunity? I mean, largely speaking, it's protection of a group of people, that herd, by way of having the infection or being vaccinated. Now, this again depends more on the infection, and infections aren't all the same. So when we talked about herd immunity with smallpox, one of the only viruses ever to be eradicated from humanity, the vaccine was so potently protective that nobody got it after they were vaccinated. So we were able to say, if we got that many people vaccinated, we were going to push it into the back corners of the earth. And with measles vaccines and mumps vaccines, many others, they were so effective, they broke that chain. And those viruses in these cases didn't mutate or change to get around vaccines. Unfortunately, COVID and other coronaviruses do change. We know the Greek alphabet now of variants, and there's going to be more to come. So it does get around the vaccines, albeit less impact on people's health. But I think it's less likely that we're going to be able to talk about herd immunity in that purest sense of it, because the immunity from the infection itself isn't lifelong in an individual.
Okay, that's really good. We're actually coming close to the end of time now. Owen, what's the main take-home message you'd like to leave everybody with tonight?
I think we're in a fantastic place in this country. I think we're in a fantastic place because of the public health information and advice, and because of society's willingness in Ireland to follow the evidence and the science. And that's what we've done here. We've learned an awful lot from this, and we can take some of those messages into other areas of health. I mean, people who live with chronic lung conditions, respiratory conditions, some of them have had a very good winter because of those other interventions, washing our hands, wearing masks, taking up flu vaccine as well as COVID vaccine, you know, staying away from people who are ill, staying away from work if you're feeling sick, not passing it on to your colleagues. These are things we should carry on to improve our health beyond the pandemic.
Great. Fidelma, what's your main take-home message for our viewers?
I would divide it into two. The first is, if you're one of the few people in Ireland that haven't got vaccinated yet, please go get vaccinated. Look at the data. It's really convincing that it will protect you. And then the second is, if you do get symptoms, go get tested. Because although I've said about breakthrough infection being mainly asymptomatic, sometimes you may have mild symptoms. And in Ireland, we're very lucky that we essentially have barrier-free testing and we've barrier-free vaccination. You can make an appointment, no hassle for either. So get vaccinated. Any symptoms, go get tested.
Great. And finally, Cillian, what would be your take-home message?
I'm going to echo that word fantastic that both Fidelma and Owen used. It has been a fantastic response by the Irish people. Over 90% vaccinated. It's amongst the highest in the world. It's been quite extraordinary. I'm actually going to quote from Bloomberg, which is a respected international news and business site, which issues a monthly analysis, well regarded and well respected, called the COVID Resilience Ranking. And this identifies which countries are handling the crisis most effectively, with the least social and economic disruption. They look at things like containment, vaccination rates, overall mortality, and progress towards restarting the economy. And in this month's analysis, Ireland is ranked 4th in the world, which is quite extraordinary. By comparison, the UK is 22nd, the US is 25th, and New Zealand is 29th. So we're doing well, but we do need to keep going. Please don't ignore any health issues that arise, whether you think they're COVID related or not. Go to your GP. Normal service has resumed. Get yourself checked out and don't ignore things. We're all in this together, and the Irish people have shown great commitment, and I'm quite sure that they're going to continue to do so, and we will weather this storm together. Quite optimistic that we're coming towards the end of this rather dreadful period in our lives.
That concludes our discussion today. My thanks to our guest speakers, Dr. Owen DeBarra, Professor Fidelma Fitzpatrick, and Dr. Cillian McGrogan. Learning to live well as we emerge from the pandemic is the theme of the next two discussions in the RCSI MyHealth Lecture Series, which will air on the 19th of October and the 16th of November, respectively. You can find out more information about these and other events on the RCSI website. From all of us here at RCSI University of Medicine and Health Sciences, thank you for watching and stay safe.